Hello, I'm Dr. Ashmina Khalsa. I'm the Senior Consultant Obstetrician Gynecologist at Cloudnine Hospital, Lucknow Division. So, postpartum is a period which begins right after childbirth and goes up to 42 days after the delivery of your baby. This is a period of immense changes in your body. There's a fall of certain hormones, there's a rise of certain hormones, there's an entire change in your appearance, an entire change in how you feel, both emotionally, physically, mentally. It is a time where you require the maximum support from your family. It's a time where you're accepting the fact that you're now a new mom. So in these conditions, let's discuss a few important things. A lot of you would have undergone a cesarean section. Yes, a lot of you will also experience pain following cesarean section, even following a normal delivery if you have been given an episiotomy. A good way to get relieved of this pain is adequate rest, analgesics. Please take your medication as prescribed by your doctor on your discharge summary. Please do not bend, forward bend, lift heavy things. These are actions which can actually aggravate pain. A good habit to alleviate pain, or for those who have had a normal delivery and who've had a cut, is to undergo something called a sitz bath, where you would sit in a round tub, warm water, a cup of Betadine full or just warm water, and sit in it. This warmth that you get is actually a pain relief. Coming to rest and sleep, an adequate rest and sleep is a must. A lot of you get advises that when the baby sleeps, you sleep. It's a little hard to sleep all throughout the day and be up all throughout the night like your baby. But a good idea is that for a couple of hours, somebody in the family is helpful enough to take care of the baby so your mummy gets her entire rest. This rest is essential for you to catch up on your health and to catch up on your milk production. A well-rested mother will definitely have more milk production. Coming down to nutrition, it's essential to have an absolutely nutritious, lactationally nutritious diet. We have to avoid certain foods, certain drugs, which can probably even cross the breast milk and come to your baby. Certain foods which must always be inculcated in new mom is fruits like papaya, fruits like guavas, apples, nuts, oats, almonds, figs, sesame seed. A lot of water, a lot of milk intake should be taken by the mother. Jeera and ajwain, what we do in North India, again, a very good source of galactagogue. It helps produce good milk. A mom who has just delivered must have at least 600 extra calories in a day. So it's a good idea to be in touch with us or be in touch with your nutritionist so an adequate diet chart can be made and it can be followed. When we talk of personal hygiene as new mom, again, a lot of us have this concept that you cannot shower for a couple of days after delivery. Trust me, nowadays cesarean sections are so safe that it is actually advised that you can even shower on the day of discharge. You can shower on a regular basis. Most of you would get a waterproof dressing, so there's absolutely no problem with the dressing getting wet, as we will anyways be calling you at the end of the third day or the fourth day for a dressing change. For those who had a normal delivery, good idea that you don't squat on the floor and sit on a little stool and shower. Now, to maintain personal hygiene, it is also important that you change your pads regularly. A lot of you will be experiencing a little amount of bleeding during your first few days, and this bleeding may sometimes even continue up to 30 days. So good idea to have a regular change in pad to keep a track in case this bleeding becomes excessive or there's a smelly discharge. Please come back to us for a routine follow-up or SOS in the emergency if you develop a fever. For pelvic floor exercises, it is advised that we begin our pelvic floor exercises even while we are lying down with something called the Kegels. Kegels will help us tone up our pelvic muscles, and especially for those who had a normal delivery, good idea to start these exercises maybe at the end of 1 week when your pain is relatively less from the episiotomy cut. If you don't have an episiotomy cut, you can begin pelvic floor exercises absolutely immediately, and our team of expert physiotherapists will be there to guide you in your postpartum follow-ups of how to do it, and so will we be. Thank you.